Welcome to another part, my dears. Just let us. We were talking about the patients who's encountering the sickness or illness, and we were talking about the points which we should care about as PSW. So we said that if a patient, those are the common reactions. First, for the illness, it's including no joy, no happiness, fear and anxiety, sadness and grief, depression, increased hunger, loss of bowel and bladder control, denial, and anger. He's always anger and denying. They say that he is sick or feeling illness. And we said the fear and anxiety for the PSW's duties is know very well that these are fears and anxieties or consequences, one of the major consequences of the sickness itself or the illness or disability, whatever it is, one of the things which as a result of is the fear and anxiety. The change in the behavior of the patient or the client needs a special understanding to a situation and understanding also to the consequences of what happened to him due to illness. And we talk about it here. And we said this here, however, it is real. Some clients will communicate their fear and anxiety to the PSW, but some of them also will hide their feelings inside themselves. You deal with the situation with a kind of passionate. Then we had a question here about how can the PSW deal with fear and anxiety of clients due to illness? How can he deal with the fear and anxiety of the client that's due to illness? Move forward after this into these points also. These are common emotional reactions to acquired disability if there is disability happened. So like confusion, anxieties, panic, inadequacy and humiliation, anger and sadness, grief, hopelessness, despair, disorganized because he will be disordered, fatigue, loss of interest, withdrawal of the situation, trying to be lonely and isolated and don't like to talk to the others. Now we will move into the second point of the consequences of the illness or disabilities. The second consequences is sadness and grief. So clients facing any kind of loss are usually sad. They are always, no one is happy with sickness. No one is happy with the illness. Those with serious illness and disabilities often deal with many kinds of losses or loss of position, loss of independency. Now I was carrying my family. I was responsible and now I'm ill or sick. I cannot do this rule again. I feel like I'm not anymore independent. I'm depending now on people around me to help me, to give me a cup of water, this and that. Loss of confidence also. I don't have confidence in myself no more. For some, there is loss of their dreams for the future. Yes. The only dream for the future is just that you try to stand on your feet again. This is the patient trying to stand on his feet again and walk and be normal. This might be his only dream. But other than this, no dreams for him for the future because he will feel frustrated. These losses can cause intense grief, like you see here. These clients are grieving and need to mourn. Observe and listen to your clients. So here now, as a PSW, I have to observe and listen to my clients so that you can understand their needs. You know, each client has 5 types of needs. Physiological needs. We have safety needs. We have social needs. We have self-recognition needs or self-actualization, and we have esteem needs. Esteem, then self-actualization. So it goes like this in this order: physiological, then safety, then social needs. Then after the social needs, we have esteem, then self-recognition or self-actualization needs. Right, to check out what are the needs of your client who is experiencing illness. Some clients may not want to talk about their feelings. Yes, some of them might hide their feelings. They don't like to talk about it. So be aware of this. Whereas others may find it helpful to talk to an understanding and caring person. So try to be that caring person. As a PSW, you should try to be the caring person who care about the patients. So know how to care about them. It's how you will deal with the sadness and grief with your own clients. So the common reactions which we said for a person, we said this before: dread, embarrassment, shame, pity, disbelief, and disregard, and dehumanize. These are the things which any patient feel it when he gets sick. Now we talk before right now about the sadness and the grief of the clients when he experiences the illness. Second thing now is depression, or the third thing, we call it depression. Depression comes from fear, anxiety, and sadness, and grief can cause anyone to feel depressed. So as a result of the fear, anxiety, sadness, and grief, this will leads to depression. The manifestation is called reactive depression. However, clients who are coping with serious illness, progressive disabilities, or in the case of some older clients, the loss of lifelong friends and family members are at risk of more serious depression called clinical depression. So we have reactive depression and we have clinical depression. Okay, again, the reactive depression comes from reaction because of the consequences of the fear and anxiety and sadness leads to reactive depression. However, the second kind comes from losing lifelong friends or family members and the risk of more serious depression. So when it becomes more serious depression, that will be a clinical depression. The first one is as a result, the reactive depression is the result of fear and anxiety and sadness. The second one, which is clinical depression, is a result of losing lifelong friends or deep depression cause a clinical depression. So these are the points. This is about the depression. So here, I will stop here right now and ask you a question. What is the difference? What is the difference between the first one, the first depression which we had, which is called reactive depression, and clinical depression? Between reactive depression and clinical see this now, sorry about this, reactive depression and clinical depression. So what is the difference between the reactive and the clinical depression? Again, I would say here, please look also search Google for more points. I just want you to write the answer inside your notebook. I don't need you to submit it to me here. If you want to submit it, you can submit it here in this chat box here, right here now, in the chat box, if you want, if you wish. But mainly, I want you, instead of typing it, write it inside a notebook, that you have a notebook, so that because this notebook will be including the main points which we are talking about while lecturing you. So here, we say, what is the difference between reactive depression and clinical depression? So what is the difference between reactive depression and clinical depression. Like we said before, here it is. The reactive is a result of the fear, anxiety, and sadness and grief, can cause anyone to feel depressed. This manifestation is called reactive depression. For the clinical depression, when depression goes further and deeper, and it's like losses of lifelong friends and family members, we call it clinical depression. So I'll stop here like around a few minutes for you guys to get your answers for this question. We'll go to the next point right now. So here we are saying clients who are depressed are often tired, anxious, and uninterested in life. So when they get to be depressed, they are no longer interested in life. They may avoid contact with other people. They don't like the contacting with other people. Clients who are severely depressed may be suicidal, means that it will lead them to suicide, to commit a crime on themselves and kill themselves. Observe closely for any changes in client's mood. So you, as a personal support worker, have to know your client's mood. You have to know your client's mood and check out any changes in his mood. To check, you observe, because you will be watching him. You have a shift of 8 hours or 12 hours. You will be in eye contact with your client. So check out how your client looks like, how your client is acting, if there is change in the mood or no, and report it to the nurse or your supervisor immediately on the spot if you find any change in the mood or whatever. Because like we said here, sickness leads to depression, depression leads to high levels of depression, high levels of depressions leads to trying to suicidal like this here. So you have to try to keep the client safe as much as you can. Once you find any kinds of change in the mood of the client, then in this case, report it to your supervisors. Report this to your supervisors. So these are the points and the duties of the personal support worker when dealing with a client with a depression. When dealing with a client with a depression. Denial. How is a denial? What's the meaning of denial? We said one of the consequences of the sickness or illness or disability that will be experienced by the clients soon as he gets this illness, or once he experienced the sickness or the illness or the disability. One of them is called denial. So what's the meaning of denial? Denial is a refusal to recognize and admit the truth. Now I would say, as example, I'm having a kind of headache, so severe headache. No, this is because only I have been exposed to the sun. It's not a trauma, it's not a problem in the brain, it's not a brain tumor. No. But you did already check for your brain and you made x-rays and there's a brain tumor. No, this is only because I woke in the sun. That's the reason. Clients is always refusing to recognize and admit the truth. Clients sometimes the clients themselves, they don't use prescriptions. They don't need, or they don't admit to use the medication. They will not say, as example, if I just drink this liquid, it will make me okay. If I ate this, I will not feel. If I had a low blood pressure, then I will eat a piece of cheese, and it will raise the blood pressure, and so on. So all these kinds is kind of refusal or denial that he or she is sick or experiencing illness. Clients who are afraid that they might be seriously ill may downplay or deny symptoms. Sometimes they also deny the symptoms itself. Even clients who know that they are seriously ill may deny their situation. Examples is too much. For example, a teenager with diabetes may refuse to take her insulin or may demand food that he should avoid or she avoid. A middle-aged man with heart disease may continue to shovel his driveway in spite of his doctor's strict order not to do such heavy work. So people are like, they like to deny the sickness. They like to deny it, like, because I don't want to feel I'm less than the others. I don't want to feel that I'm disabled to do work or whatever. Their ways of coping may be to deny that they have serious health problems. I know a lot of people like this way. They even refuse to take medicine sometimes. They refuse to take medications, and so on. If you think a client is denying their condition, be understanding and show a positive attitude. If the person's denial may cause harm, let your supervisor know. Always when you see a client disordered or is not in his nature, or his mood is changed, or he refused to take his medicine, he's lying to take the medicines or whatever, then in that case, on the spot, report to the nurse or to your direct supervisor. Report to the nurse or the direct supervisor. Don't wait. Don't write in a report or something like this and just keep it. No, you keep your eye on the client. If the client is having any issues or any problem, then directly report to your own supervisor or to your nurse, the supervisor level of nursing. Okay, how about the anger from angry? Some clients may be angry because they resent their limitations, their illness. Especially I see this always when I was working in hospitals. When you put them under restraints, when you put the patients to restrain the patient, this was a very big problem because in that case, the patient's anger level will increase. They may direct their anger towards their physicians, family, friends, or caregivers. So the anger here, they will just direct it into one of these people. It's like, as an example, sometimes they put the angers in their wives, or the wife put the anger in the husband, or they put it in the PSW or so on. You have to understand and comprehend that this is because of the sickness, and you must be very passionate and very tolerate with your clients if they show anger. Some clients may direct their anger towards their support workers as well. That's what we are saying. So in this case, you have to be very tolerate, and you have also to just be quite sure and be aware that this is due to the sickness which he is complaining of. So you should remain calm, patient, and gentle with the client. Avoid becoming angry yourself. So don't exchange with him the anger with anger. Yeah, reacting negatively will only make the situation worse. So if you just go on a revenge with the client who's angry, that will escalate the situation and will cause more and more problem. Try to understand their client's needs and problems as well. Imagine what life must be like for him. Just put yourself instead of him. You will compromise him then for what he's doing. You will then compromise him or her for what she or he are doing. However, you don't have to accept abuse. Don't accept abuse. So, as example, to learn what to do when faced with an angry client, just report to your supervisor directly. Report to your supervisor directly. Some words you need not to use it, and some words we need to use it. So do not use words like crippled, and lame. Say person with disability. Say instead of just saying like he's crippling, he's crippled, he's lame, he's laming. No, say person with disabilities. Deaf, mute, deaf, and dumb. Don't say like this. Person who's deaf. Uh, yes, so this is how to deal with it. If it is epileptic person who lives with epilepsy, fit, attack, spell, seizure. Handicapped, don't say handicapped. Say person with disabilities. Don't say handicap. You don't need to say the word handicap, but say person with disabilities. Don't say the handicap parking and the bathrooms. Say accessible parking, accessible bathrooms or washrooms. Say the word accessible. Don't use the word handicap. So on all the way up, don't use the word handicap. Use instead the words like accessible and so on. Hand of hearing, hard of hearing, or hearing impaired. Uh, person, say person who is hard hearing. Okay. So these are the points which you have to say and not say. Insane or maniac or whatever. Then say person with mental health disability. Don't say insane. Don't say crazy. Don't say mental. Don't say neurotic, and so on. Mental insane. No. Just say person with mental health disability. Person with mental health disability. So as a PSW, they do not use this word, crippled. Use a person with disability. Don't use deaf, mute, and so on. Say also person with deaf. Epileptic, say that epilepsy, fit, attack, spell, seizure, say instead, say seizure. Handicapped, don't say handicap, say person with disability, the parking, and so on, say accessible parking, accessible washrooms. But don't say parking or parking for the handicapped or handicap parking. No, don't say handicap parking, but say accessible parking. Don't say handicap washroom, say accessible washroom. And also here, don't say crazy or maniac or insane. Say person with mental health disability. Person with a mental health disability. It's more better to say like this, to talk like this. We have also a holism that involves considering all dimensions of health, like physical, emotional, social, cognitive, and spirituals. Yes, that was a part. Okay, persons factors that can influence dimensions of health are what will affect the health in a person? What will affect the health in a person? Personal life skills. This is the first point. Stress will also affect the health. Stress leads to a big problems and panic consequences like more sickness, heart attacks, and strokes and so on because of the stress. Personal beliefs, burnout as well because of stress. Personal beliefs about healthcare, social relationships and belonging. Personal beliefs about healthcare is including also home remedy instead of medication and so on. The level of education also affect social relationships and belongings. That's another point. And scenes of control. Also, I would like to say that the social economic situation affect the health. Like in the third world, people who are not able to buy the medications, they don't buy it. They leave themselves without medications or depend on something like home remedy for their medications instead of taking real prescriptions. Like as example, some people for the blood pressure, they might take some hot drinks, which will reduce the blood pressure. And they think that this will make them be comfortable and the blood pressure will go down. These are all things that affect the health. So here, the health dimensions will be affected by personal life skills, stress, the beliefs and the culture, social relationships, and sense of control. These are the things which will affect the health. Shall go to the next part.